Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Neisseria meningitidis. So, Neisseria meningitidis can cause infections worldwide with varying incidence across different regions depending on the subtype. So, subtype A, for example, causes epidemics in the meningitis belt of sub-Saharan Africa, whereas subtypes B and C are more prevalent in Europe and in the USA. Adolescents and young adults in particular are at increased risk of infection, particularly in crowded settings such as college dormitories and military barracks. Transmission occurs via respiratory droplets or direct contact with respiratory secretions of infected individuals. So Neisseria meningitidis is a gram-negative diplococcal bacterium, and as we've said, it's classified into serogroups based on capsular polysaccharide composition. However, serogroups A, B, C, W, X and Y are most clinically significant, and serogroups B and C are most commonly associated with invasive disease. Neisseria meningitidis colonizes the nasopharynx asymptomatically in carriers. In susceptible individuals, however, the bacterium can invade the bloodstream and cross the blood-brain barrier, hence causing meningitis. The lipo-oligosaccharide and pili and the outer membrane proteins contribute to virulence and the ability to evade host immune responses. The clinical manifestations of infection with Neisseria meningitidis can be wide-ranging. Meningococcal meningitis or meningococcemia, or a combination of both, are the most frequently spoken about. Meningitis comprises a presentation which includes fever, headache, neck stiffness, photophobia, and altered mental status, and this is something you may well have seen on the acute medical take. Meningococcemia also involves a fever, rash, as well as purpura and a septic shock. Manifestations such as pneumonia and pericarditis are more uncommon, but complications can occur from the primary infection, including disseminated intravascular coagulation or DIC, adrenal hemorrhage, and Waterhouse-Friderichsen syndrome. And this is associated with bilateral adrenal hemorrhage associated with meningitis. The diagnosis of meningitis is based on clinical suspicion and laboratory confirmation. A lumbar puncture is usually performed and should be performed, and the CSF would be expected to show an elevated white cell count, elevated protein, and decreased glucose, and it should be noted that this is specific to bacterial meningitis secondary to Neisseria meningitidis. Blood cultures should also be taken. The management of meningitis comprises third-generation cephalosporins, for example, ceftriaxone or cefotaxime. Supportive care, including fluid resuscitation, vasopressor support, and management of complications, is essential. Neisseria meningitidis prevention is part of the National Vaccination Schedule. There is a conjugate vaccine targeting serogroups A, C, W, Y, which is part of the immunisation schedule for teenagers, and meningitis B vaccine is also given in infancy. Vaccination strategies for high-risk populations, such as adolescents and travellers to endemic regions, are crucial, and contact tracing and chemoprophylaxis for close contacts of cases help to prevent secondary transmission. So now let's try a question. Which serogroup of Neisseria meningitidis is commonly associated with outbreaks in adolescents and young adults, particularly in college dormitories and military barracks? So our options are serogroup A, serogroup B, serogroup C, serogroup W, or serogroup Y. And the correct answer in this case is serogroup B. And you'll remember this from an earlier slide which discussed the various serogroups and their prevalence in various populations. And this is quite a common scenario that might be talked about in an MRCP question, and so it's worth remembering this. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.